You can see the COVID vaccines distribution around the world. It's very clear that dark colors is where we're getting vaccines out. You can see where Africa is at. The disparity is obvious.
Yes, the population of Africa is younger, but we have populations with a number of comorbidities, as Faith pointed out: diabetes, hypertension, obesity, and of course, HIV. The net effect is that the real impact of COVID in Africa is likely several times worse than is generally acknowledged. The reason why many think there is no COVID in much of Africa is simply because we do not know where to find the deaths. And this has had further knock-on effects. Perceptions that mortality in Africa is not bad has resulted in diminished vaccine availability and a strong sense that vaccine equity is not important and not an important part of the global COVID story.
We also must remember that these vaccines are a product of decades worth of public investment in science. So for medicines, for all medicines, we know that the public pays up to 2/3 of the R&D cost. And, this model of drug development was skewed even before COVID. But with COVID, I think we all realize we have to vaccinate the world probably multiple times over in order to achieve vaccine-induced herd immunity. So really, the model that we have is broken. It has to be changed.
I think that what we're doing now in terms of not enabling everybody who could get access to COVID vaccines to get that is, again, a global crime against humanity. And it is foolish for the same reasons that not giving people access to antiretroviral treatment globally was very foolish at the time. So what you do when you do that is you strip out the healthcare workers and the young people of young working age from the population. And in Africa, for example, there already is a huge scarcity of healthcare workers, and some countries are still suffering the after effects of Ebola. So you're really damaging what's going to happen for years to come. You leave a large viral reservoir. So in HIV, we now know that one of the really important ways to reduce new infections of HIV is to reduce the community viral load. So you can have a conception of whether it's a city or a country or the globe, how many HIV virus copies are out there, and you can do something similar with COVID. And as long as your global levels of virus are high, you're going to get new infections and you're going to get mutations that are going to be resistant to vaccines. So it is a really stupid, in capital letters, STUPID thing to do, not to do everything you can globally to reduce the viral burden.
With a fast-moving pandemic, no one is safe unless everyone is safe. So we are not safe unless the people in the poorest countries are safe. So why is that? Because COVID outbreaks will continuously erupt in non-immunized populations, like fires that never quite go out, because cinders keep reigniting. And these outbreaks will inevitably continue to spread around the world to Europe and Ireland, seeding new outbreaks here, wave after wave, unnecessarily prolonging the pandemic.
But I actually think there's a really strong self-interest argument that for COVID to be dealt with in Ireland or in the EU or America or wherever, it's absolutely essential that it's dealt with in other countries in the world. Otherwise, we'll have what people might call the epsilon variant, but I don't know, we could call the omega variant. It just will continue to evolve into new variants that will potentially spread in vaccinated populations. So as I really like Cléanna Kelly's talk about HIV community viral load, there's this idea of the coronavirus burden of the world, and the lower it is, the less chance of new variants and less evolution happening.
I have to say, I didn't know there were so many countries that could, or companies that could make mRNA vaccines, and that's very, very encouraging to hear that. But this is the way forward. It's not Ireland giving 500,000 doses to a single African country. There's a 5 billion population we have to vaccinate. So it's about enabling countries like the African countries and also India. India have 2 biotech companies can easily make 1 billion doses of vaccine a year, Bharat Biotech and Serum Institute of India. And there, as Akhil said, there are African countries can do so well. So to me, it's about enabling those countries to make the vaccines for themselves and for the rest of the world, and not simply about a small country like Ireland giving away 500,000 doses, which will have a very little impact.
There's no doubt that doctors and scientists and nurses and other healthcare professionals in Ireland, many of whom come from other parts of the world, are keenly aware of the need for a global response to this virus. And I think one of the things that I've learned on the call today, or one of the quotes that will stay with me, is We cannot donate our way out of this this crisis. So to generate this global vaccine response, it's not a matter of us versus them, or a vaccine in my arm means, a vaccine in my arm is better than a vaccine elsewhere in the world, or worse than a vaccine elsewhere in the world. It's about generating this political pressure to change the approach to vaccine production globally.
The TRIPS waiver effect is not for us, it is to allow the global south to produce for itself. And as was said earlier on, that is actually how we got out of the HIV epidemic, how we brought that under control. It wasn't through donations. Production in the global south is what did it, because it's only through doing that that you have predictability and security of supply. At the moment, countries in Africa and other parts of the world are relying on donations that are coming in month to month. Some of them are so close to expiry they can't prepare. There's a whole load of problems related to the nature of the donation system. It just doesn't work that efficiently.
But when it comes to mRNA vaccines, practically anyone who's in the pharmaceutical industry can possibly make them. The list that I'm working on, which will be released later this month and at the beginning of next year, is a list of literally over 100 companies across Asia, Latin America, and Africa who all have this capacity. They have the investments required to put it in. They literally need the keys to get into the same safe deposit box, right? I mean, the gates just need to be unlocked and this can happen. So Pfizer and Moderna are under immense pressure to increase the volume of output of vaccines they can produce, right? Themselves. And that's an option. If they can magically create 10 billion vaccines a month, then people won't put this much pressure on them to license other companies to do so, right? So what they're doing is, and what they've been doing right from the start, by the way, is going to companies with no experience in anything. Pfizer's newest licensee is a manufacturer of scientific equipment that used to make their refrigerators. I'm just saying, they have a full manufacturing license now and are going to be producing hundreds of millions of mRNA vaccines. Their expertise is refrigeration, right?
Yeah.
So there's absolutely, when you look at the companies that they themselves have gone to scale up their vaccine production, it is extremely clear that this is the easiest technology to reproduce if you allow somebody else to do so.
And in effect, what we're doing by having this inequity of vaccine is we're encouraging infections in the world. We're driving up the burden across the world in terms of illness, obviously, but we're also encouraging the virus to continue at a very rapid rate to learn how to overcome our immune response. And that is going to drive change in the virus. And it's, in effect, if you were to design an experiment that would lead to new variants, we are doing the perfect experiment at the moment. We're creating populations that have low levels of vaccination, and we are allowing that virus to run amok among the population.
I think on the one hand, you've got government, and on the one hand, you've got 3 or 4 pharmaceutical companies saying, leave it to us, just trust us, and we'll make, everything will be fine, while they're making, I think it was the figure, $2,000 a second at the moment for their vaccines. On the other hand, you've got a group of scientists who don't really have got any particular interest other than doing the right thing, who are saying, listen, you actually must ensure vaccine equity, and it really should be a no-brainer.